right, before the break, we asked how many Americans are afflicted with Alzheimer's disease. The answer is D. Estimates from the U.S. National Institutes of Health estimate that 5.1 million Americans have Alzheimer's. So for the first time in 27 years, there are new guidelines for the diagnosis of Alzheimer's disease. They identify 3 stages of the disease, and they incorporate biomarker tests. We'll explain what that is in a moment. But first, Dr. Bill Lloyd is our healthy living expert. He joins us now to talk about these changes. So, Dr. Bill, let's talk about the 3 stages of the disease. How are they different than what we knew about them before, and what do they mean?
Expert guidelines have categorized Alzheimer's, Frederica, into 3 categories. In the past, there were only 2, mild to moderate and severe Alzheimer's. But now there's 3 categories, including the important first category, which we call preclinical Alzheimer's. This means individuals have no symptoms whatsoever, but they have measurable changes, abnormal levels of these biomarkers that we'll mention. These changes predate the development of Alzheimer's disease by maybe 10 or 20 years. The second category is called minor cognitive impairment. And this is the milder early form where people notice changes in their memory or their language, and maybe their family notices as well, but these individuals are still able to move along and function in everyday life. The third category is Alzheimer's dementia, where there's a profound drop in both thinking and behavior noticeable to the patient and the family. These 3 categories have completely reorganized what we know about Alzheimer's disease.
And so learning more about these, I guess, precursors, then, does that help us find out, detect whether we are going to have it?
It's very important to say that these biomarkers are not related to the cause of Alzheimer's disease and don't assure or guarantee that someone is going to get Alzheimer's disease. These are laboratory studies that research over the past several decades have confirmed a high correlation, meaning if you're not having any symptoms, but you have these abnormal levels, you might think about options for treatment to protect yourself in the years ahead.
Okay, so now let's talk about those biomarker tests. What are they exactly, and how is it that they measure these biological changes in the brain?
Sure, there's 2 big categories. The first measure the changes in brain tissue, and this is done with typical brain imaging, things like CT scans, MRI, or PET scans. They actually measure the change in the amount of healthy brain tissue that an individual has. This, of course, decreases over time. Then there's a series of blood tests, tests for specific carrier genes for Alzheimer's disease, and spinal fluid tests looking for amyloid and other proteins that we know are dangerously associated with Alzheimer's disease.
Okay, and since we know there's no cure for Alzheimer's, what kind of benefits are we learning from, the idea of diagnosing it very early?
Frederica, if I told you 1 year from today your house was going to be robbed, I've got a strong feeling you would spend a lot of time over the next year protecting your property to protect yourself from that possible robbery. Same thing goes for Alzheimer's. By now knowing with the use of these biomarkers, individuals who are susceptible for getting Alzheimer's, early intervention, early medical treatment can preserve that valuable brain tissue before the disease moves on. Now, there's no cure for Alzheimer's, but we know that appropriate use of medical therapy for Alzheimer's will delay the onset of symptoms and prolong the symptoms without disease progression. So once again, if you knew the burglars were coming, you take some extra steps.
You try to protect yourself as best you can. All right, thanks so much, Dr. Bill Lloyd. Thanks so much. Good to see you.